MacLean here. Today I'm going to show you how to do non-aerosol restorative treatment. We can do this by using hand instruments and Aqua Forte HT glass hybrid restorative material. And you can use this material to help stabilize your patients, and you can use it as a definitive restoration. All right, so now I'm going to demonstrate on a typodont how to place an Aqua Forte HT fill, and to accomplish this without using air-driven high-speed handpiece or even a slow-speed handpiece. That way we can reduce or even eliminate the production of aerosols. So you can see I've simulated an occlusal carious lesion here, and what you want to do is use hand instruments. So you can check with your Explorer to detect the soft caries. There's a variety of hand instruments you can use. My personal preference is the spoon excavator. So you just go in and remove any soft caries with a spoon excavator. So any of that soft, leathery dentin, if you can remove that. And ideally, you want to have clean cavo surface margins. That will help prolong the lifespan of your restoration. And I've done many restorations with this technique, and they are absolutely definitive restorations where 1, 2, 3 years later, the Aqua Forte restorative material is still in there. So remove all the soft caries that you can. Of course, you want to protect the pulp, so don't go so deep that you potentially expose the pulp, but try to clean the cavo surface margins. Okay. So you have sound dentin and nice margins. All right, so now we're ready to use the cavity conditioner, which is a 20% polyacrylic acid. And what this does is it removes the smear layer and helps improve chelation and chemical bonding of the Aqua Forte HT restorative material to the enamel and dentin. What you're going to do is you're going to take the conditioner and place 1 drop in your dappen dish. You're going to take a micro brush and soak it in the conditioner, and then you're going to condition the lesion for 10 seconds. And I should show you, just for reference, the box of Aqua Forte HT will come with this handy reference card that'll remind you all of these steps and time. Okay, so don't worry about that, but just 10 seconds of conditioning. Now you're ready to rinse the lesion. But again, we're trying to do this by reducing aerosol. So instead of using a 3-way syringe of air and water, what you can do instead is rinse the conditioner using wet gauze or a wet cotton roll. I like to actually use a little wet cotton pellet. Okay, and you just clean the conditioner. That. You don't want to over dry or desiccate, so just blot the excess moisture. So you don't want any pooling liquid, but the surface should glisten. This is a hydrophilic material, so it will chemically bond to enamel and dentin without needing a bonding agent. And you do want some moisture, so don't over dry it, but also don't have excess pooling moisture. Okay, so that is ready. So now you're ready to mix your Aqua Forte HT fill. You want to remove it from the pouch right before you're ready to mix it. So just take it out of the wrapper, just like it's a piece of candy. And you'll notice the capsule there's a liquid and powder component inside the capsule. The first thing you want to do is tap it on its side to loosen the glass particles. And then you'll see this red button. You want to press that in to help break the seal between the liquid and the powder. And now you can place it in a capsule mixer. This is GC America's capsule mixer, which is, in my opinion, the nicest and quietest and easiest to use. You notice how it's swiveled, so it's really easy to place. Close the lids securely and then mix for 10 seconds. The material sets in 2.5 minutes, so I like to have a timer to keep track, and you want to start it right when it's done mixing. So you want to work quickly. Take it out of the mixer, place it in the applicator. You're going to click twice to engage the capsule, and then squeeze carefully to help introduce the material up into the tip of the applicator gun. And then you're going to come right over to your cavitated lesion and express the material into the cavitation. You can use excess material as a sealant in the other grooves. You can use hand instruments to help place the material. Some people also like to use a damp Q-tip, or you could use a damp microbrush. But you don't want to overwork the material. You don't want to introduce excess moisture. You also don't want to over dry the material. But it will set in 2.5 minutes. So after the material has set for 2.5 minutes, you want to apply the Equia Forte coat and place a drop into your dappen dish and coat a microbrush and apply it to the material. And you want to light cure it for 20 seconds. So 20-second cure. All right, so now it's all finished, and you can see it's a nice aesthetic restoration. This material is incredibly durable. It's also wear resistant. So this can be a definitive restoration. It could also be used to help stabilize a patient if you're not able to use hand pieces and do a more definitive preparation of the tooth. But I have cases where I've used just hand instruments and Equia Forte that have lasted for years. And there's literature to support that, demonstrating that in the atraumatic restorative approach, you can use glass ionomer restorations as a definitive restoration, and they last comparable to resin and even amalgam.